over the past 4 days. Every shift that I've been on, we've lost somebody.
These pictures bear witness to the tragedy unfolding in many care homes in Europe. According to a recent study, they account on average for half of the deaths linked to COVID-19. But was this inevitable? We spoke to families, care workers and associations in the hardest hit countries. They tell us about some of the worst, but also best practice. Milan, capital of Lombardy. To date, the region has the highest number of cases of coronavirus in Italy. This care home is one of the largest in Europe, with 1,000 residents. More than 200 have died there since the start of the crisis. A criminal investigation has been launched. This trade union activist, who works in the care home's pharmacy, believes many lives could have been spared if safety measures had not been delayed for weeks.
At the beginning of March, some employees took the initiative to put on masks. They were reprimanded and forced to remove them on the pretext that they were frightening the patients. Also, the region needed to free up hospital beds in order to prepare for what could happen with COVID, so it assigned patients to care homes. Unfortunately, there were no checks in these places.
More than a quarter of the centre's 1,000 employees have contracted the virus. Understaffed, the teams are exhausted and bitter.
For those of us who are still working in the residence, no tests whatsoever were done, and they continue to move us from one unit to another as if nothing has happened.
Alleged wrongdoings that many care home workers in Europe say are widespread. For this Spanish care assistant, the situation has become all too much.
The dead, I had to put them in bags. I had to stretch them out because they died shriveled up like this. I witnessed this. I had to close their eyes. I had to take them down to the morgue, and when the morgue was full, I took them to the underground car park. If an isolation unit had been opened at the start where anyone who showed symptoms could have been transferred and the other residents had been left in their rooms, and if all the carers had had the protective equipment which were not delivered to them for 2 weeks, I can assure you that the spread of the virus in the home would not have occurred.
Heartbroken, many families of coronavirus victims are also angry. This Spanish couple was swept away by the virus just days apart. They used to share a room in this care home. Their children blamed the lack of medical care for their parents who died in sedation after their condition suddenly got worse.
It's very hard, very difficult to imagine them like that. Were they alone? Were they together? Did they condemn each other? How can I know? There's no way. I don't know. Neither my father nor my mother deserved this kind of death. They were not allowed a place in a hospital or a ventilator because they were 86 years old. For us, it just feels like they were completely abandoned. Our elders are literally being abandoned.
Much of Europe's care home sector is concentrated in the hands of large private groups, often run by pension and investment funds. Activists say the lucrative business puts profit before safety. Eileen Chubb is a former care worker turned whistleblower. Through her association, she's long campaigned against wrongdoings of the industry.
There's too many care companies that are quite willing to fill beds, and they don't mind at what cost. And because care home staff are running on a wing and a prayer with staffing ratios, it doesn't take much to tip this over the edge. These companies have made billions in profit. And then we've got a situation where they're saying they couldn't have foreseen this crisis and bought protective equipment for their staff. It is outrageous.
The lack of resources in many nursing homes in Europe has led in places to the army being drafted in. At this Belgian home, these specialized military staff helped stop the hemorrhagy after 17 out of 128 residents died during the first weeks of the crisis.
At the start, we did not have the necessary protection. We tested everybody in the home on the 7th of April, and it turned out that 75% of residents and 51% of staff were COVID positive. So we called in the military to help us take care of the residents.
In a rare number of cases, some retirement homes have managed to resist the deadly tide. This one, near the city of Lyon, is now famous in France. For several weeks, the head of this care home and a large part of the staff decided to isolate themselves day and night with the residents. The result? No one was contaminated so far. In order not to jeopardize that, we film everything through windows. Given what's happening right now, how do you feel about the fact that the staff decided to move in with you?
Everyone is really lovely. I have to say they're a bit like family for me. I see the workers going back and forth. They come to say hello, then they carry on with their business. It makes me really happy.
As of March 18th, more than half of the staff moved into the home with their suitcases and sleeping bags. Rallying around their director, they were determined to save the home's 106 residents.
Our residents are not isolated to their rooms, so they're still able to have social contact with other residents, as well as with us, as we see them all the time. They don't have the feelings of being abandoned or of loneliness.
Everyone here agrees the huge effort has been worth it, despite the personal cost.
I have a 10-month-old son, so of course he's at home and obviously he is changing and I'm missing him a lot. But for me it made sense to stay isolated here, to protect the residents and to protect my family as well.
The home's director believes lessons must be learned from a health crisis that has had devastating impact on the care sector.
OK, let's go. Do we agree? OK, same line of conduct. We're all together. It's taken a global catastrophe for people to realise what's really going on in nursing homes, and that is a lack of means, a lack of funds, a lack of staff and a lack of recognition of our trade. And really now money must be made available and directed towards the elderly, as they're not a burden, they are our memory. So we have to love them and be there for them, and above all we need to make sure that they have a tender and pleasant life until the end.
At least for this small community, the efforts have paid off. After a total of 7 weeks of isolation, all the residents and staff were tested. None tested positive for coronavirus.